Well, intermittent fasting is a health lifestyle that has quickly gained a large following. An Indianapolis-based startup LifeOmic has created an app to help people adopt that practice. Although the app is only about 6 months old now, Business of Health reporter Kylie Veleta tells us it's seeing some swift success. Kylie.
That's right, Gary. The app called Life Fasting Tracker has already surpassed 300,000 downloads. It's an impressive number, but perhaps not surprising, as it's the brainchild of serial entrepreneur and Indiana tech giant, Dr. Don Brown. He joins me now to tell us more about his latest venture in LifeOmic. Thank you for coming to the show.
My pleasure.
You're also a medical doctor, in
Yes.
addition to being a tech giant here in Indianapolis. So start with, what is intermittent fasting and why is it so popular right now?
Well, just briefly, we've known for a long time that severe caloric restriction, eating very little, improves people's lifespans and makes them healthier. This was discovered back in the 90s. There's even a society of people who try to get by on 1,200 calories a day for years. And there's no doubt they're healthy, they live longer, but they're not very happy people because they can't have beer, they can't have pizza, they can't have the things that we enjoy. I was going through a graduate program in biotechnology at Johns Hopkins about 3 years ago and stumbled onto some papers about intermittent fasting and proving really at a very detailed molecular level that we don't have to deny ourselves and try to live on 1,200 calories a day, but rather we can starve ourselves intermittently for a few hours a day. And that's the genesis of intermittent fasting.
And it's getting a lot of attention for losing weight, but it's not just for losing weight.
Not at all. There are all sorts of health benefits. Certainly for me, my motivation wasn't losing weight, but rather extending my healthy lifespan and hopefully reducing my risk of getting diseases like Alzheimer's or the Parkinson's that I saw my mother die of.
So how are people using the app on a daily basis? Just a quick introduction.
Well, they're using it to track their fast. We had built a cloud platform that we use at IU School of Medicine for a number of cancer teams, and we thought it would be fun to have, and useful, to have a mobile app that could tie to that cloud platform and provide some scalability test. I had our mobile team build a little fasting tracker that lets you click to start or stop the time of a fast, share the information with family members, and it just took off. We thought we would have a couple thousand people using it. This week we passed 350,000 people around the world.
That's fascinating. Talk a little bit more about the connection with IU School of Medicine and broadly the bigger picture for LifeOmic and what you're doing.
Yeah, well, the real work of the company is to create a cloud platform because in healthcare we're generating unbelievable amounts of information from electronic medical records, DNA sequencing, all these big data sources. And the healthcare establishment is having trouble storing that information and then developing insights from it that would help patient care. And so we've been working as part of IU's grand challenge, their PHI, to help several disease teams, including a breast cancer team, actively loading up information about their subjects and then using our platform to analyze it and try to figure out why is it that one woman will respond well to therapy and live a normal life and another will succumb to the illness relatively quickly.
All right, well, Dr. Don Brown, thank you so much for being here today. Really helped give birth to the Indie Tech movement here in Indy.
I'm glad to be here.
Thank you. Gary, back to you.